Hello, I'm Dr. John McDougall. I've been in medicine since 1968, and I've been practicing medicine with a license since 1972. And a good share of the focus of my attention during those years has been on cancer, more specifically breast cancer. And I've seen the treatments that doctors have to offer for breast cancer, and they're not pretty. I mean, women have had as much done as having their breast taken off, the muscles underneath their breast taken off, and their nodes in their armpit taken out. And even, 100 years ago, they used to take the arm on the affected side. I have to tell you, all that surgery, all the way from terrible mutilation to basically doing nothing, has made no difference in survival at all. And the studies are absolutely consistent on what they show. And if you add radiation to that surgery, again, it makes no difference in terms of survival. There are a few studies that try and make a suggestion that there's a difference, but I don't believe they're true, and the basic science and the nature of this disease say that it really cannot be true. The benefits at best are small, and the harms done are huge. So what do I recommend for some woman who does get diagnosed with breast cancer? Well, I recommend that you have the obvious tumor taken out. And what that means is you have the tumor taken out with clear margins. And that's it. No radiation, no breast amputation, nothing else routinely done. Well, what if the cancer comes back? And it does. It comes back more often if you don't do extensive surgery and radiation. Well, if it comes back, then you get more of the tumor taken out, and or at that time you get some radiation. The survival's the same whether you did all of that extensive mutilating treatment initially or you did it later when you got a recurrence. And let's just say 40% of women have a recurrence after a simple lumpectomy. Well, that leaves 60% who are free of cancer, wouldn't need these extensive treatments. And then, of course, doctors give chemotherapy, and that's a whole nother disaster. The benefits from there are small. In fact, they're no greater when it comes to breast cancer than, say, you cut a woman's ovaries out or gave her anti-estrogen drugs. I mean, this is a business you really do not want to get into. And if you do get into it, go into it with your eyes wide open. Ask your doctor, show me the scientific evidence that says this extensive therapy is going to make me live longer and or better. You're going to be surprised at how little evidence there is in that direction and how much evidence there is as to the harm you're going to have done. So I ask you to be an informed consumer. I ask your doctors to be conservative. And as a result, you'll have a much better life. I'm Dr. John McDougall.